What is the recommended dose of folic acid for women with diabetes planning a pregnancy? Correct answer, 5 milligrams per day. At what HbA1c level should women with diabetes be strongly advised not to conceive due to high risk of adverse outcomes? Correct answer, 86 millimoles per mole. What is the target fasting plasma glucose level for women with type 1 diabetes who are planning pregnancy? Correct answer, 5 to 7 millimoles per liter. Which of the following is not listed by NICE as a risk factor for gestational diabetes? Correct answer, polycystic ovary syndrome. What is the NICE recommended 2-hour OGTT threshold for diagnosing gestational diabetes? Correct answer, greater than or equal 7.8 millimoles per liter. What is the first-line oral glucose lowering agent recommended for women with GDM when diet and exercise fail? Correct answer, metformin. NICE recommends metformin as first-line oral agent in GDM if diet fails. Which of the following medications should be stopped before pregnancy? Correct answer, ACE inhibitors. Which of the following is the recommended long-acting insulin during pregnancy? Correct answer, isophane insulin. Which HbA1c level is recommended for women with diabetes planning pregnancy if achievable without hypoglycemia? Correct answer, less than 48 millimoles per mole. Which of the following is a new diagnostic criterion in NICE NG3 for GDM? Correct answer, 2-hour OGTT greater than or equal 7.8 millimoles per liter. What intervention is recommended for GDM patients with fasting glucose greater than or equal 7 millimoles per liter at diagnosis? Correct answer, immediate insulin with or without metformin. When should a woman with GDM be referred to a dietitian according to NICE? Correct answer, at diagnosis. Women with GDM should be referred to a dietitian immediately upon diagnosis. Which of the following is advised as a daily exercise recommendation for GDM management? Correct answer, walking 30 minutes after meals. What should women with type 1 diabetes planning pregnancy be advised about ketone monitoring? Correct answer, use blood ketone strips when unwell or hyperglycemic. When should structured education be offered to women with diabetes planning a pregnancy? Correct answer, before stopping contraception. When should retinal assessment be offered to women with diabetes planning pregnancy? Correct answer: if not done in past 6 months. Which contraceptive method is contraindicated in women with diabetes planning pregnancy? Correct answer: according to UKMEC, based on risk profile. When should OGTD be offered to women with prior GDM according to NICE? Correct answer: early and again at 24 to 28 weeks if normal. What advice should be given to women with diabetes regarding pregnancy risks and duration of diabetes? Correct answer: risk increases with duration of diabetes. Which glucose levels should be used for self-monitoring in preconception planning according to NICE? Correct answer: 5 to 7 millimoles per liter on waking, 4 to 7 millimoles per liter before meals. What blood glucose monitoring pattern is recommended daily for pregnant women with type 1 diabetes? Correct answer: fasting, pre-meal, 1 hour post-meal and bedtime. What is the target 1 hour post-meal glucose for pregnant women with diabetes according to NICE? Correct answer: less than 7.8 millimoles per liter. What is the minimum glucose level recommended for insulin-treated pregnant women with diabetes? Correct answer: 4 millimoles per liter. When should HbA1c measured during pregnancy in women with pre-existing diabetes? Correct answer: at booking and consider in second and third trimester for risk assessment. Which insulin analogues are preferred over soluble human insulin during pregnancy? Correct answer: Aspart and Lispro. Which of the following should be available at all times to insulin-treated pregnant women? Correct answer: fast-acting glucose like dextrose. Who should be offered real-time continuous glucose monitoring? Correct answer: all women with type 1 diabetes. When should ketone testing be performed in pregnant women with diabetes? Correct answer: if hyperglycemic or unwell. When should retinal assessment be offered during pregnancy to a woman with pre-existing diabetes? Correct answer: if not done in past 3 months and at 16 to 20 and 28 weeks. Which value of serum creatinine warrants nephrology referral in pregnancy with diabetes? Correct answer: greater than or equal 140 micromoles per liter. When should ultrasound monitoring for fetal growth and amniotic fluid volume begin in pregnant women with diabetes? Correct answer: from 28 weeks every 4 weeks. When is induction of labor recommended for women with type 1 or type 2 diabetes without complications? Correct answer: at 39 weeks. What blood glucose range should be maintained during labor? Correct answer: 4 to 7 millimoles per liter. What should be done if glucose is not maintained between 4 to 7 millimoles per liter during labor in a diabetic woman? Correct answer: use IV dextrose and insulin infusion. Which medication should not be used for tocolysis in women with diabetes? Correct answer: beta mimetics. When should babies of women with diabetes have their first routine blood glucose check? Correct answer: at 2 to 4 hours. Which condition is not listed as a reason for admitting a baby of a diabetic mother to NICU? Correct answer: feeding well and normoglycemic. When can babies of women with diabetes be transferred to community care? Correct answer: after 24 hours if feeding well and normoglycemic. What is the minimum pre-feed blood glucose level to be maintained in newborns of diabetic mothers? Correct answer: 2 millimoles per liter. What is the initial feeding advice for neonates born to diabetic mothers? Correct answer: feed within 30 minutes and then every 2 to 3 hours. What should be done if neonatal glucose remains less than 2 millimoles per liter despite maximum feeding support? Correct answer: start IV dextrose. What test is used for neonatal glucose monitoring as per NICE? Correct answer: ward-based glucose electrode or lab method. When should insulin be reduced in women with pre-existing insulin-treated diabetes after birth? Correct answer: immediately after birth. What risk should be explained to breastfeeding mothers on insulin? Correct answer: postnatal hypoglycemia. There is increased risk of hypoglycemia during breastfeeding. Which medication can be resumed postpartum while breastfeeding in women with type 2 diabetes? Correct answer: metformin. What is the recommended postnatal screening for persistent hyperglycemia in women with GDM? Correct answer, fasting plasma glucose 6 to 13 weeks. What fasting glucose value indicates high risk of future type 2 diabetes postpartum? Correct answer, 6 to 6.9 millimoles per liter. What HbA1c value postpartum indicates low probability of diabetes? Correct answer, less than 39 millimoles per mole. How often should HbA1c be repeated in women with prior GDM and normal postnatal test? Correct answer, annually. Offer annual HbA1c testing for women with prior GDM who had a normal postnatal screen. What test should be offered in future pregnancies for women with prior GDM? Correct answer, early glucose monitoring or OGTT.